Hi, everyone. Welcome to our webinar featuring Wellstar Health System. During today's session, we are going to discuss ServiceNow's health and safety solution. So if you are a customer considering the health and safety product for your organization or just someone who's looking to learn more, you are absolutely in the right spot. This will be an excellent opportunity to hear directly from another customer on their value, their results, and lessons learned. In terms of our agenda and flow for today, we're going to start with a brief introduction to our speakers and to ServiceNow's health and safety solution. Then we're going to go into a customer presentation and discussion between Wellstar and Stridepath. And I know personally, I'm most excited for this portion because I always say that customer stories are the best stories, and Wellstar has a really great story. Then I'm going to provide a quick demo to bring some of the concepts that we're going to discuss to life. And then as we close out today, we will have some time dedicated for live Q&A. And before we go into introductions and our official content, I do have 3 quick housekeeping notes that I want to share. First and foremost, speaking of Q&A, please feel free to add your questions in the Q&A area of the Zoom panel. We will be monitoring that throughout today's session. And like I mentioned, we'll have time carved out at the end to talk about a couple of those questions that you have live. We will be sharing the recording from today's session. Expect to see that in your email by next week, if not tomorrow. And then last, but certainly not least in terms of the housekeeping updates, Stridepath is actually doing a giveaway today to a lucky attendee for a pair of Apple AirPods. But to be in the drawing, you have to be present for the entire webinar. So make sure to stick with us for the whole session and look out towards the end for the announcement of who that lucky winner is. And if we haven't worked yet together, if you haven't recognized my name from maybe another webinar, my name is Allison Fulton. I lead our health and safety product team at ServiceNow, and I'm helping facilitate today's webinar, and I'm thrilled to contribute to the conversation. I'm also joined by Will and Dianne, who I will pass to now for introductions from them.
Hi, everybody. My name is Will Finnegan. I'm a managing partner and SVP of our customer success team at Stridepath. Been with Stridepath previously the anti, as I already fumble for my words 2 minutes into our session, for about 8 years, focused primarily on core business services, employee workflows for the entirety of that life, and then have previous lives in the Workday ecosystem, iCIMS, which is applicant tracking, and then a bunch of other HR and technology related roles. Super excited to speak with one of our partners today, who we've done a lot of work and are just kicking off some more. Dianne, I'll turn it over to you next.
Thanks, Will. Hi, everybody. Dianne Kokotoff from Wellstar Health System. I am in the IT department, have a couple of different teams. And of course, ServiceNow is one of my major teams. And within that space, I've been with Wellstar for about 7 years, been using ServiceNow as a product owner slash user for almost 11 years. The only person who's more than me is my director, Larry. So we make a really great team in having a good history with MoveWorks, with ServiceNow. Yeah, prior military, spent my entire career. I am an IT born baby. I feel like I've been doing it since I was in college. So yeah, happy to be here. And thanks, Will, for inviting me.
Awesome. Thank you both. We are in for a treat in terms of the content for today. Can't wait to hear more from both of you. Like I said, we are going to start with a very brief overview of what our health and safety solution on ServiceNow is, just in case you're not very familiar. And where I want to start specifically is by articulating our vision for the product. That vision is to help our customers create a culture of safety on one unified platform. And we know this is a really large need within the market because we know it's common for a lot of organizations to actually have 6 or more point solutions to cover their needs across the areas that you see here on this slide. And when I say point solutions, this might mean that you have one solution for managing your safety incidents, another for your health and safety risk assessments, another for your inspections, another for tracking your vaccination status, and the list goes on. So by investing in a comprehensive health and safety suite on our ServiceNow platform, we're really helping you create a single pane of glass for your health and safety experiences and your health and safety data. And of course, we do this in an omni-channel and AI-centric way to ensure that we're meeting your employees where they are, whether it's in a deskless environment, maybe they're in a clinical setting, or whether they're desk-based. And we're also helping you focus on the highest value work for your employees by reducing as much of that manual work as we can with AI. More specifically, if we can go to the next slide, I want to talk about 3 of our biggest initial investment themes for health and safety specifically. So first, we help our customers make safety digital and accessible to their entire workforce. And we know that there are a lot of manual processes and even things that are still paper-based in this domain. So we really help ensure that your employees have easy access to the information that they need to stay safe and productive while they're at work. We also help our customers shift left and be more proactive and preventive to bring down things like incident severity and mitigate safety risks before they become issues. And then when those incidents or emergencies do occur in the workplace, we really help our customers automate and streamline their response and their investigation to those incidents. And again, I mentioned this before, but we invest in all of these areas with an AI-centric mindset. And in fact, one of the things that I want to walk through next, just in terms of product overview, I want to spotlight 3 of the live and existing AI use cases that we have available within health and safety. So first up is our conversational intake experience. And what this is doing is it's creating a frictionless experience for your employees who are reporting safety incidents. It's taking them through a guided conversational intake process to really make sure that all of those relevant details are captured up front. And it's eliminating friction that may exist across health and safety teams and employees just to make sure that all of that correct information is submitted. And of course, again, I've mentioned the fact that we're omni-channel. This is available from our Now Mobile app as well as Employee Center if the employee is on a laptop. Next, if we can go to the second slide, the other use case that I want to highlight around AI for health and safety specific is incident summarization. So one of the things that we know about safety incidents is that they can be complex in nature. They can include a lot of different people. There's typically a very specific process that's followed to conduct all of the right steps to make sure that that investigation is thorough. So this could include going through a root cause analysis process, assigning actions, whether those are corrective or preventive actions. And one of the things that most organizations like to do is they like to summarize all of that detail and share it out to stakeholders across the organization to make sure that that incident doesn't reoccur. So with incident summarization, you're able to actually use a button to summarize all of those details regarding an incident. So the event details, the root cause analysis, as well as those actions. And this is really also improving productivity for health and safety teams, again, because these incidents can be so complex. This is saving them a lot of time and manual work. And then last but not least, if we can go to the third slide, we have our incident investigator use case. I'm really excited about this one. This is actually our first agentic AI workflow that's live with health and safety specifically. It just released in May. And what this is doing is it's actually helping you draft preventive or corrective actions as it relates to your incidents. And so the way this is working is it's actually looking at relevant incidents in your historical history. And it's also looking at things like knowledge-based articles and those related actions against those incidents. And it's using that to actually draft actions for that incident and really create an action plan. And of course, this is helping you drive efficiency with that action creation process and that investigation. And a little bit later in today's session, when I go through the live demo, this is the use case that I'm going to show you. So you're going to see exactly what this looks like. So that was the last slide that I wanted to go through in terms of the product overview. Next, I'm going to pass it over to Will to talk a little bit more about Stridepath.
Thanks, Allison. I'm going to do my best not to stumble on my words on this one, but really been a great partnership that we've been building over the last 8 years with ServiceNow. Currently, we are approximately 71 consultants, technologists, and industry practitioners. We have completed over 350 ServiceNow HRSD engagements, including things like safety management and legal service delivery, just to name a few of the other components that fall under employee workflows that we've been working on. We're super excited to be partnering with both Now Assist and MoveWorks with ServiceNow as well. And really just, I think, bringing to light a lot of what we consider employee experience and human-centered design. So when you look across Stridepath and our work, we're not focused on a single industry. We're not focused on a single vertical. We work with the healthcare industry, and then we work with state, local, federal government. We work in high tech and finance. And I think that really helps us bring to bear learnings from all of those different industries, and it allows us to really help our customers realize the value of their investment with ServiceNow, and then also gain efficiencies and experience across both the external users, the consumers, the employees, as well as your teams that are responsible for using the platform and helping your employees. I think now I'm going to hand it over to Dianne to talk a little bit about Wellstar.
Thanks, Will. I won't read all of the numbers to you, but Wellstar is a healthcare provider in the state of Georgia. We do have a few other associated states where we do have some offices, but for the most part, we are in the state of Georgia. We actually serve 1 in every 6 Georgians, which is something to say about a healthcare system. And we do provide some of the most uncompensated, most uncompensated care in the state of Georgia than any of the other health providers within the state. So we're very proud of that. And we are very much a patient-focused, patient-first facility.
So thanks for telling us a little bit about Wellstar, Dianne. When we think about your implementation journey, I know you've been using ServiceNow for quite a while, but when we look at the footprint that you have, and as Allison mentioned earlier about some of the various point solutions, what made you consider ServiceNow as a platform to leverage the health and safety application?
Yeah, well, everybody knows a very small event that happened in the year 2020. It was called the pandemic. When that happened, we were actually faced with a CDC requirement that required us to take the temperatures of every single team member as they entered any of our facilities. So, of course, we took the patients, but we also took our team members. So during that time, I reached out to ServiceNow and said, have you ever heard of this? Have you ever heard of a solution? Do you have anything that we could try to automate manual temperature taking? And that's when they introduced me to health and safety.
Besides learning about the ability to help with some of the things during that wild time known as COVID, um, what were the primary focus areas that helped you drive that decision as this platform being the right solution?
Yeah, so the temperature taking, it was a short-lived CDC requirement, but as we had purchased the product, one of my key responsibilities to Wellstar is to make sure that we expand the value of ServiceNow. I am all about trying to, if I own it, what else can I do with it? So once we got through that initial requirement during the pandemic, we started looking at what are the other things that we could use this tool for. And vaccine requirements in healthcare is a huge requirement. At the time, it was COVID and flu. It is now currently just flu. But we were able to work with Stridepath and really create a very robust system for both of these vaccines and all the modalities and variations of the vaccines that come with it, as well as create a vaccine exemption process, because there are multiple ways you can request and get approved for a vaccine exemption. So, and all of this had to do with compliance. You'll hear that as a common theme when I talk about the health and safety. So now we're not only able to support our internal users, we're actually able to support all of our ancillary members, such as contractors and vendors and students.
Yeah, I know we had a question about that earlier in the Q&A. And when I think about the power of the platform. And you touched a little bit on it. Um, Compliance obviously is key, but there are moments that matter for both your internal employees and some of the, as a hospital system, some of the people that aren't necessarily employees that are coming into the facility. What, when we think about providing value during those moments that matter, how did you decide on the functions that would make the biggest impacts?
Well, obviously, being able, people come and volunteer. Who wants to be told, oh, well, we'd love to have you help, but, we don't have a way of keeping track of you. That is very disheartening for a volunteer. So for us, keep going back to that compliance, right? We had to maintain the compliance, but how could we do that? Maintaining the mission of taking care of our patients, but providing this methodical way of capturing all those requirements that we needed to do. So for us, being able to provide that extra value for something that seems small, but has a huge impact on the community as a whole, was very important to us. We've also done things with like having the N95 mask compliance, right? Being able to find ways of making sure that we don't lose a team member's compliance and understand that they have to get a mask. So for us, it was all about being able to stick to the plan, stick to the regulations, but at the same time, provide that experience to our team members and to other people in our Wellstar community to support what we're trying to do.
That's awesome. I mean, it sounds like beyond just streamlining the process and bringing humanization to it and trying to make it easy and intuitive for all of the guests that were coming in, all of the employees, all of your clinicians. Um, what were some of the business outcomes that you as Wellstar were looking to achieve?
Right. So obviously, the compliance regulations piece being HIPAA compliant, that was one of our definite main cases. But we were also looking for ways to make it more user focused, right? An example, if someone needed to self-report an illness, we had to make that simple for them. And that has all kinds of ramifications. It supports making sure that employee is taken care of and is supported from a health perspective. It's making sure that whatever shift that person was on, we're able to cover that shift so our other patients are taken care of, and just to make sure that all who needed to know were communicated and we're in the loop by using the workflows and the automated processes. So for us, that's really a lot of the business of the business outcomes, being able to also help our employees. So employee health team members were inundated with an enormous amount of work not only during the pandemic, but also on a regular basis, ensuring that we follow these rules and regulations for vaccinations and N95 and self-reporting. That required a lot of external work. So we needed to make sure that we built those workflows and we built automations so that we could provide them value. So looking at that, trying to help to do the validation and ensuring that that we are driving it back to patient safety was key for us.
Absolutely. And it creates, I know the term is virtuous cycle, but I think it's a great representation of helping your employees' lives become easier so that they can help your patients, your customers' lives be easier. And then it just builds that wonderful feedback loop that, it makes it so that people I we all enjoy coming to work, right? But it makes it so that it doesn't feel burdensome, and we're delivering,
Absolutely.
that consumer grade experience both at work and then outside of it.
Absolutely.
When you think about the journey that you've made with health and safety, what do you think are some of um, the things that make you the most proud of the journey so far?
Um, I would say that the external portal, that to me moved the needle in getting through the weird and wonderful areas that we were struggling with. Um, so for me, and getting anything out of an Excel spreadsheet, which we were doing tons of, and emails, being able to report on the information and provide valuable metrics, that I think really I'm most proud of during our journey.
That's awesome. Is there anything that stands out that the team, the project team that was on this, that helps you realize these results or helped bring some of them to life?
Yeah, I mean, obviously, so Stridepath, back then the Ante, was our sole vendor in helping us implement this module, and I will say, the team that was brought on, they were fantastic. They helped us do things that a lot of people wouldn't have thought about because they were outside of the box. Creating a custom table to enable a Blue Prism process automation into our employee health system. Not in the realm of the idea back in 22, right? Helping us navigate the processes. I mean, that was huge. We really we were in some ways at the time we were the blind leading the blind. So just having the expertise on the stride path side was huge for us.
That's awesome. Um, excuse me. And the team this morning all were pinging me saying, "Oh my goodness, we're so excited you and Dianne are speaking again today." So, very, very mutual feeling. It was great to go on the journey and learn and
Right.
find creative solutions together.
Absolutely.
I know you mentioned some of this already, but what do you think were some of the biggest benefits that were realized by Wellstar as part of
Yeah.
this?
Well, from the manual temperature taking, obviously, financially, it was a much better choice than you know having clinicians take other clinicians' temperatures. Um, but overall, like labor hours that we saved in the self-reporting, that was not insignificant. But and I think I go back to the fact that having it in one place as a reportable and auditable structure, that just surpasses most of our benefits.
Absolutely. Any other call outs before we talk about what I think is probably one of the most valuable besides the actual product that we delivered, the
What do
lessons
you
learned?
think, Phil?
I come back to I really feel like making people's lives easier with this platform, with this solution
Absolutely.
is huge. And I don't know that we can quantify that in dollars or in hours, but I think that this bleeds into some of my favorite areas, the gray areas, where you're really impacting, right? You're making it so that it's not a challenge to do some of these little things. Like being able to expose it to some of um, your external volunteers, I think is huge. And it shows the power and the creativity of this platform. Um,
Yep.
so that
Absolutely agree with you.
Yeah, that was what I loved that part, that we were able to find a solution for not only allowing for the submissions, but also the sharing of information so that people could be prepared for it and not feel like they were coming in blind to the process.
Mhm. And easy to use too.
Totally. Totally.
You didn't need a master's degree to submit your vaccination.
So following getting everything live, what advice would you give to some of our friends that are on the call today? What key lessons learned would you share with
Yeah.
them?
Yeah, I think for us, not really fully understanding some of the complexities and variations that can occur in employee health, that was a big deal for us. I would absolutely suggest spending the time, at the front end. Make sure you really understand that. Get with them, communicate, really try to, when we communicated this, I mean, we did our typical communication methods, but it didn't always trickle down to the end users. So I think if I were ever to do it again, turn back the time, I'd probably look for some alternate ways of communicating, making sure that everyone, really got it. We're actually using some of our own lessons learned in new implementations, and really driving down to those unit level huddles and things, just to make sure everybody hears it.
And I think that message is really powerful, staying present and actually learning from these previous engagements and then being able to apply them to the future
Mhm.
and making sure that you bring that mindset of how do I keep making this better? How do I keep making sure that communications are effective, that we've gathered requirements and we've thought about all of the different audiences. Um, I think those are great recommendations. Um, looking at our journey, what surprised you the most out of all of it?
Oh, okay. So I was thinking this is going to be simple, because when they showed it to us, it's like, oh, they fill in this form, they attach a file, and bada bing, bada boom, and it's done. And hey, just convert a Word document basically to the ServiceNow catalog item, and that's it. And ServiceNow does its magic on the back end, puts the data in, you have tables, you report on it. Yeah, it wasn't really like that. um, I think just with the ongoing changes of process and regulations, vaccination changes, you really have to be prepared to give it a little TLC, kind of back to my lessons learned, which is make sure you really get the process straight, walk through them. To me, that actually surprised me. I do not come from a medical background. I come from an IT background, many years of IT. So we tend to look at things a little bit different. So it was definitely a learning curve for me, but something I try to make sure I push forward in all the future work that we do.
It's awesome. And very much hard to identify with coming from that landscape. I want to pull on a thread that you had mentioned about, making sure that you have gathered all of this up front. Is there anything that you would have done differently as we look at the engagement and what we rolled out?
Yeah, well, so something I have learned over the years through process automation is when you sit there and pull requirements, the typical thing to do is say, tell me what you do, right? And write it down. Tell me what you want and write it down. But what you don't realize is that as humans, we do tasks that we don't even compute. So when you're sitting down and actually saying, okay, I'm gonna shadow you for the day, and I'm gonna watch you do it. And then all of a sudden you're like, well, wait, that's totally different. Oh yeah, because this variation occurred and this happens, and the moon is in the seventh sun type thing. Therefore I do this. So it's not always A, then B, then C. Sometimes it's A, then B, then D, then F, then C. Oh, and then let's add a G at the end. So that becomes a huge play when you're trying to provide a product that encompasses at least as much of the 80% rule as you can. So for me, what would I do differently? I would absolutely work much closer with them to walk through. And again, learn from your mistakes, right? We had that pitfall. We learned. I don't do that anymore. I sit there and I'm like, we're going to watch you for a week.
Mhm. And I think you said something really powerful right there. Designing for the 80%, right? Because we're not always going to be in the seventh sun moon, I think you said. Um, but it's important for us to capture those use cases. It's important for us to make sure that we're meeting everyone where they are with the way that they work, but also realize that we can't identify every edge case and build for that. That was one of the more powerful things that I took away from our journey. Um, and I think that you've hinted a few times now about how you have continued leveraging ServiceNow, how we've expanded on what was deployed. Thinking about the future, knowing that we might not know when COVID-20 or what else comes through, avian bird flu or something. Um, what's on your roadmap for the next handful of months as we're looking to turn the calendars to 2026? Let that
I
sink
know.
in for a second. 2026.
2026. It's hard to think about that, right? Yeah, well, so at Wellstar, we are looking at moving employee health to Epic. We use Epic for all of our other products, and that is going to require some redo. So, of course, we're looking at what are the pieces that will require changes in automation using HL7, using the API connection from ServiceNow to Epic, and seeing what we can do there. We're also looking at, are there any AI capabilities that we can use to assist with manual validation? I mean, right now, somebody is still looking at a CVS receipt to say, is that really, flu 1, 2, 3? So there's some possibility there that we can use AI to extrapolate that. And we are a MoveWorks customer. So we're also looking at ways of expanding our MoveWorks to include some agentic AI capabilities with respect to vaccination submission. And of course, health and safety is not enough for us. So we've got Stridepath coming in actually very soon to help us do some HR optimization with our HR module. So lots of fun things happening.
It's super exciting, and we're so happy to continue to be a part of this journey. I know we're coming up to the end of our part. Any closing thoughts, last comments before we turn it over to Allison to show us some of the platform?
Yeah, I guess the only thing I would say is, when deciding to implement it, make sure you get a partner who has, been there, done that type thing. As I said, I was surprised at how complicated it was. Granted, I am not a healthcare person, but I am an IT person, and taking a process and automating it, that's what I do. So I think just having the right partner is going to go a long ways. You've got the product right. Great. That's step one. Get the product right. Now get the partner right. And then you'll be good as gold.
Awesome. Thanks, Dianne, for spending a couple of minutes sharing the journey with everyone.
Absolutely.
Allison?
Thank you.
Yeah. Allison, I think we're turning to you.
Fantastic. Thank you, Dianne and Will, for that great discussion. Like I said at the start, customer stories are the best stories, and that is a phenomenal one. Just kind of reflecting from my perspective on your conversation, I love the emphasis on making a genuine impact on people's lives and that correlation between patient and employee safety. I love that you highlighted that. So now I am excited to walk through a demo of health and safety, and I am going to be using my other monitor and looking over here. So I'm going to turn off on the demo and not my side profile. Let me just take over screen share here. And Samurai, I think you might have to stop sharing actually. It's telling me that I have to request that. Here we go. I think I have access. Perfect. All right. And can I just get a quick confirmation that you all can see my health and safety workspace? Perfect. Thank you for the thumbs up, Will. So I'm going to keep this demo relatively brief, but as I mentioned at the start of the call, I wanted to focus and emphasize in on our agentic AI workflow that is now live within health and safety as of May. And to start, we are logged in as Mike. Mike is a member of the health and safety team, and he's starting his day in our health and safety workspace. So this is really where he can glean insights on key information and metrics that matter. And this is really tailored to each user who's logged in based on their role and what's relevant to them. You can see down here, even if Mike were to have work assigned to him, it would also appear down here. He doesn't have any assigned there right now, but this really is just, again, helping him start his day and really looking at things that matter to him most. In fact, one of the things that I also want to highlight is that in our latest release of Health and Safety, which was just put out on July 31st, we majorly enhanced this dashboard with additional leading indicators. Mike doesn't see all of those because he doesn't have all of the access to things like overdue actions or inspections, for example, but wanted to emphasize that this is a very big investment, and a lot of the latest innovations that we've put into this dashboard were coming directly from customers. And I just want to make a call out. One of the questions that we already got in the chat was, how does health and safety allow you to really understand your data and the scope of different incidents and trends and events? And this is just kind of a preview into how that would work. So hopefully this is helpful to see in that context of that question. Now what I'm going to do next is I'm going to click into our list of open safety incidents. And for our demo, I'm going to go ahead and click into this medical incident that was reported by Maria to showcase that AI use case that we talked about before. And to keep our demo rather quick today, I've gone ahead and I've pre-populated some of the data and information against this incident. And what we're looking at here is called our Health and Safety Incident Playbook. And this is really designed to drive efficiency for people like Mike, so the people who are working on those incidents and completing the investigations in the workspace. And so I'm going to kind of walk through the different sections of the workspace and kind of the steps that Mike would typically follow if he's the person assigned to this and the investigation. So this first portion of the playbook is really providing Mike with a summary of the incident. So he can see things like the severity of the incident, who opened it, the category, the short description. And then if we go into the next section, this is where additional details could be added against this incident. As I mentioned earlier, we know it's pretty common for safety incidents to be complex in nature. There's a lot to document and capture in terms of the specifics. And so this is where Mike could add additional details about what happened before, during, and after the incident. And we can even see a bit more information in addition to that short description. We have a longer form description here. We can also see as a part of this incident that Emily was actually the person who was injured, and she was ultimately taken to the hospital by her colleagues based on the injury that she did incur during the incident. And speaking of that, if we go on to the next section of the playbook, we do have a dedicated area here where our customers can actually document out who are those various people who were involved in the incident. So like we already talked about, Emily was the injured party, so we can see that that association has already been added here. But let's say that you actually had other people who were involved. Maybe you had a witness who was there during the event and you want to document those details and add in their contact information. This person could even be an external party who maybe witnessed that incident, and you could add in their details and preferred method of contact here. Again, to keep things simple today, I won't add anybody besides Emily, but did just want to call out the fact that you do have the ability to add multiple people here. And one common FAQ that we get a lot of times is, do you have the ability to actually add multiple injured parties? And the answer is yes. So let's say that there is an incident that's severe and it actually is impacting multiple people. This kind of just shows that list view of what that would look like if you did have multiple people who were perhaps injured. The next thing I want to show is actually what the root cause analysis process looks like. So Now that Mike has kind of reviewed those details, he's documented all of the findings and the people who were involved, it would be very typical for him to go through a very specific process to analyze what has really happened and why. And again, to keep the demo fast today, I went ahead and I pre-populated that root cause analysis that we can see here. A lot of times customers do ask us, what framework do you support in terms of root cause analysis? You can see here that we support the 5 Why root cause analysis methodology, but we do also have customers who use other methodologies, and this is meant to be a flexible framework. So what we're looking at here is just an example again of what that would look like if you're using 5 Why. So what we've done now again is we're logged in as Mike. He's gone through his incident. He's done that investigation. He's documented all of the details. He's gone through that root cause analysis. And now I want to talk about how that agentic AI use case can really help Mike drive efficiency with the next step, which is typically to create health and safety actions. So I'm going to click here into our Now Assist panel. And this is going to allow Mike to actually ask for a summary of this incident. So we can type here into the Now Assist panel that we want to create actions for this specific safety incident. I'm gonna go ahead and send that. And what this is going to do is it's going to confirm that we can use the Create Actions for Safety Incident feature here to analyze the details and provide some suggestions using this agentic workflow. So we can see here that the agent has performed its analysis. So again, the way this is working is it's looking at historical incidents that are similar in nature, and it's also looking at things like your knowledge base and your policies that may exist in this platform to really come up with the action plan and these proposed actions that it's presented. So we can see here that it's actually given us 6 actions to choose from. Mike would typically kind of read through those and decide if those are valid suggestions that have been made. And it's asking Mike to specify which actions he'd like to accept and proceed with. So in this situation, again, it's provided 6. Let's say that Mike is only interested in creating actions for 2 of those suggestions. We can go ahead and type that into the Now Assist panel. So we want to do 2 and 4. And what's great about this is actually going to take that from this chat and it's going to create those actions automatically against the incident. And so if we click here into actions, we can actually now see that we have both of those created. So again, we chose number 2 and number 4, and it's gone ahead and it's created those automatically against this incident. And you can see that it's still in the state of pending. And again, there is kind of that human intervention where Mike was able to independently decide which of these actions he wanted to move forward with and create against this incident. So we're really excited about this use case. Like I said, the investigation process and specifically this process of creating an action plan can often take health and safety teams a lot of time and a lot of manual work. And so this is really helping drive efficiency for Mike in drafting those suggestions and the actions that may need to happen. That way they can reduce this from reoccurring and any future issues. So that was the last thing that I wanted to demo. The one thing that I did want to mention is that we're only really looking at 1 application today out of 7. I know we got a lot of context from Dianne and Will's conversation, but just wanted to point out that we did keep this brief. Hopefully this was helpful just to get a preview into what exists in health and safety, but we definitely have a lot of additional modules and use cases that hopefully you'll all find more information on after today's webinar. So now I know we want to open it up and go into some live Q&A. And I know I was keeping track of the chat and the Q&A during the presentation. And thank you, Will, for helping me stay up to date with several of those. I believe we've answered many of them in writing, but I think it would be awesome now if we could kind of pick a couple of these to go ahead and discuss live. And I know I'm just looking through the list here. We'll start at the top. So one of the questions that came in from Erica was whether ServiceNow allows external clients to submit safety surveys. And I know Will and Dianne did an awesome job of describing exactly how this worked for Wellstar. So hopefully that helped answer the question. The one thing that I want to add that's exciting is that in our most recent release of health and safety, that one that just dropped on July 31st, we did introduce a new contractor service center to allow external contractor users self-service access to do things like complete safety incidents or observations. So we're really excited about that innovation, and hopefully that is helpful in that context as well. Dianne or Will, anything else that you would specify about that process of what you've done for Wellstar and making that externally accessible? I think you gave a good summary earlier, but just want to open it back up.
Yeah, I mean, for us, it was creating that external portal so that you did not have to, for people who did not have a Wellstar login, but we still needed to capture information. That was a big help. Also for pre-hires, right? Pre-hires who have not received their their credentials to log in, but still needed to provide the information in a safe and secure manner. So for us, that's a big deal of creating that external portal.
Absolutely. Safety is a need for everyone, not just your full-time employees. So love that focus. Another question that we received is, if we currently utilize ServiceNow within the company, how easy is it to add the safety management components to it? And I know I gave an answer in writing. Great news, if you're already an existing ServiceNow customer, health and safety uses a lot of core components, and that typically helps expedite your value and your implementation. Some examples of that would be things like your user profiles. Maybe you even are populating your user profiles, your HR profiles with an integration. That especially becomes helpful with health and safety, because similarly, we have health and safety user profiles where you can kind of expedite that process of populating the key data and details. We also are able to leverage some of the common location data that you likely have populated, your employee center portal, SSO, mobile, the list goes on. And I think this is a really great question for anyone who's interested in speaking more with Stridepath around kind of some of those common denominators and how that would be expedited if you're already a customer. Okay, I know we got the question from Denise around kind of seeing what it means to use health and safety to track and trend safety events and incidents and kind of searching on prior events. Denise, I know I kind of gave that very quick preview of the workspace and talked about how that has recently been enhanced. Hopefully that was a good preview into how that works, and definitely reach out if you want to see a deeper demo and some examples of the specific trends or events that you're looking to track. We also got a good question around just more detail on that N95 fit testing requirement. Dianne, I'd pass it over to you to see if there's anything that you'd like to add verbally. It looks like you gave a pretty thorough answer here in the chat, but I'll pass it over to you to see if you want to add context.
Yeah, I think a lot of it has to do with when you do a fit test, there are a lot of different types of masks that can be utilized. So depending on what your medical conditions are, it may require a different type of mask or maybe from a different vendor. So it really, the questionnaire delves deep into, please explain any questions. It actually does ask you for your height and your weight, because that does come into play with the fit test. But once employee health receives this questionnaire, and again, a lot of it is for pre-hire, right? Pre-hire, we want them to come in on day one with all of the tools necessary to provide patient care in a safe and compliant method. So we'll have the pre-hires go in, complete the questionnaire. Employee health will review it, send them, so they'll have 95 masks waiting for them on day one to be able to test and validate. And there's actually a few exceptions to the workflow that kind of sends out a little alarm bells where the workflow moves in a different direction and says, oh, okay, we might need to have a nurse review this with the pre-hire, or we may have to have employee health reach out to ask more specific questions. So we do have this type of exception workflow included in it. Once you're an established employee and everything, we have a way that you can just literally go into ServiceNow, say, hey, I need a new one, click, boom, done. And it cross-references the information from the employee health so that they know exactly what to send you.
Fantastic. Good level of detail there. Just looking through some of the other questions that have come in, it looks like there was a question on being able to share information between departments. So for example, workers' compensation gets the initial report of an injury, but EHS uses the same information for hazard investigations. Thank you, Will, for typing out the answer. That's absolutely right. We can configure sharing these different details across different groups. And one thing on this topic specifically that I want to emphasize is that for customers who are using both our health and safety solution and our HR service delivery solution, there's absolutely a better together, and there's a huge benefit in terms of driving that collaboration across your HR team who may handle that workers' comp or that leave processing, and the EHS team in terms of the return and the specifics of that injury. And then when we think about the actions that we have specifically within health and safety, so those actions that we used agentic AI to create, the thing that I want to emphasize about that is that those actions can be assigned to anyone across the organization, whether it's someone who's on the health and safety team, whether it's an employee, or maybe it's actually your workers' compensation team directly. So there's a lot of flexibility in how you assign those. Just checking out what else has come in. This is great. We're getting a lot of good audience engagement and really great questions. So it looks like there is a question on how you can use health and safety to track, trend, and manage workplace violence. We have a couple of different ways that we can help you address this. One of those ways is that we have a critical event management application that's part of the health and safety suite. We actually didn't spend a ton of time talking about that today. So Kyle, if you're really interested in that, I would definitely recommend maybe a sidebar conversation. But just to describe what that does, it helps you track different emergencies or events that are happening in your workplace. And it helps you kind of create a two-way dialogue between employees and your health and safety team. So in this example, let's say there is an act of workplace violence and you need to trigger an event. You'd be able to use a playbook experience to do that. You'd even be able to trigger communications with impacted employees who may be in that specific work site. And let's say that they need assistance or you need to check in with them to see if they are safe or need help. That's all something that that application does. And let's say that that workplace violent event progresses to something more serious that you do need to document as an incident. We do have different incident categories that are available out of the box, including one that covers these types of physical security use cases, where you'd be able to track that as a formal incident and again, document anyone who was involved or perhaps injured as a part of that workplace violence. So great question, and this just shows the breadth of all of what we have in health and safety. And again, we have 7 different applications. I think we talked about a good handful of them today, but we do a lot. So I'm glad that you asked about that. Okay, scanning through our questions, it looks like there is a question on the best ways to educate others on how to use the system if they're not used to it. Ruth, this is a great question. We get a lot of kind of questions like this from our customers around change management and training and what makes sense. I would say from a product perspective, our vision is to make health and safety as easy to use as possible. So specifically when we think about your end users, your employees, we hope that training isn't necessarily required. But for your health and safety team, the people who are working like Mike in that workspace, typically what we see is some training that you kind of orchestrate across that specific group who's using this on a daily basis. And we do have some content that's out and available on ServiceNow University on the basics of what to do and how to use that workspace itself. But typically this is something that partners can really be useful to kind of add to. And I'm sure Stridepath has a lot of great experience that they can speak to in terms of helping with training as a part of their scope of work.
Yeah, absolutely. And we think training starts very early on in the process, because when we think about um, team members that might not be used to the platform. And I want to distinguish between employees that are going to be the consumers of the platform, as well as the team that is then responsible for leveraging the platform on the back end. So that team of fulfillers that are going to be working with us as we're building it out and helping to provide some of those requirements, like Dianne had mentioned, under the seventh sun and the third moon of the month. We very much believe that education has to start as part of that design process, because otherwise you can't provide the necessary requirements or share how you would use the platform in your daily life. So as we continue that through the engagement and we get closer to that finalized product that we're going to be delivering out into production, that's when we start to bring that educational component to the broader team, the fulfillers that are going to be using it. And we also solicit a lot of that experience feedback at that point. So they're a great source of, is the platform built intuitively? Is it simple to use, or do we need to take a harder look at what has been configured to make systemic improvements? Um, so I think education starts super early and then it has to persist the whole way through.
Love that philosophy. And I knew you would have a great answer, Will. Thank you. I'm really excited. We're getting a ton of really good questions. It looks like we just got one around the ability to track OSHA required training completion. The answer to that is yes. So within health and safety, we have those actions that we've been talking about. We have a type of action that is learning. And so what that means is you as a customer can create learning actions and assign those to users. Or what's really great about this as well is that we have the capability to actually integrate in with your learning management system. So Erica, let's say that you have an LMS and you have courses that are required for OSHA purposes there. You would actually be able to use ServiceNow to bring in that content and embed that and track that against your health and safety user profile so you could see completion statuses of those pieces of training content. The other thing that is a common FAQ that I just want to highlight on the topic of OSHA is we get a lot of questions on whether health and safety has anything specifically for different OSHA forms that may be required for your organization to provide on an annual basis or per certain injuries. And we actually do have a dedicated OSHA content pack. And this allows you to export OSHA forms 301, 300, and 300A. So we're really excited about that. I know that that adds a lot of value for many of our customers because this can be a manual process. And we've made it as simple as the click of a button where that is basically exporting out that required data to those forms. And the other thing you might be wondering, what about other regulatory bodies outside of OSHA? We have an answer for that too. Within health and safety, we have what we call report mapping. And this is a customer favorite. And what it does is it allows you to bring your own fillable PDF. You upload that into health and safety, and you map fields that you need to export to that fillable PDF just using configuration. And this is a one-time configuration, and it really helps you scale across different industries or geographies because we, again, know that a lot of our customers have different regulatory agencies that they'd be reporting out to. So we really like how that helps meet that requirement. Okay, I'm checking out what additional questions we've gotten here. It looks like we have some questions on arranging a more in-depth demo. Absolutely, we will follow up with you after the webinar. And then it looks like we did get a question on how health and safety is licensed. This is another question that we can follow up with you offline after the webinar, but this does require a specific health and safety license and SKU. And so Stridepath and ServiceNow can follow up with you for any of those specific details around that question. All right, it looks like we are caught up on our Q&A. I'll just do a quick check-in with Will and Dianne to make sure I haven't missed any that you were wanting to verbalize, but I think we've talked about most of them. All right. With that, I think we will do a drum roll. I believe the next announcement has to do with the AirPod winner. So I'll pass it over to you, Will, to make that announcement.
Awesome. We very much appreciate everybody taking the time to spend some of that valuable afternoon that you all have with us to learn about our journey with Wellstar and ServiceNow. Excuse me. The winner that we have picked is Melissa Ingram from WakeMed Health. So Melissa, please look for us reaching out and connecting with you on how to send you your AirPods. And we will do that following the call today.
Perfect. Exciting stuff.
And just one more item that we would love to share with everybody. There's a QR code on the screen that you can use to download this, but we've put together a one-pager on health and safety, and I think the the heading under the title really hits the nail on the head for what this does, and it's shifting from being reactive to getting to be more proactive and predictive in the management of all of the features that the application can help with. So please feel free to download it. And just to help wrap us up, really, really appreciate again the time, the commentary. If you have questions, we're here for you. So please don't hesitate to reach out. You can connect with us on LinkedIn. You can grab the QR codes and reach out to us, and truly just appreciate the time today.
Yes, thank you all for joining. We hope that you're leaving feeling more inspired and more informed. And special thanks again to Dianne and Will. I love the story, and we hope that you all have a great afternoon.